Very, very hard. Very hard. It's very stressful.
MJ Grant is part of what's known as the sandwich generation. That's when you're responsible for taking care of your own children and your parents at the same time. Having the conversation about future care with a parent can be uncomfortable.
It's an incredibly hard conversation, but important. We always tell folks that it's better to plan ahead than to be in a crisis and trying to scramble, trying to find resources and supports.
It's the resources, or lack of them, that's a problem in our state. There are more people who need nursing home or assisted living facilities than there are facilities to be had. One of the keys is getting on a waiting list, and you can't start too early.
You really do want to think ahead, like a long time ahead. 5-7 years out is not a bad thought process in terms of just filling out these applications, getting your names on lists.
It's one thing to have a plan in place for long-term care, but it's another one to figure out how you're going to pay for it.
We had no idea how much it was going to cost. None.
If you want to move into an assisted living facility, you're looking at somewhere between $4,000 and $7,000 a month. If you need nursing home care, that's about $10 to $12 grand per month. And insurance could be a problem.
Medicare doesn't cover long-term care, and that's something that people don't understand. They think, well, I've got Medicare, I'm all set. Medicare only covers very short periods of rehab stays in a facility, so you're either private pay or you're main care.
But that's another problem, because there are fewer and fewer facilities that take main care each year.
I wish more places took main care because it is heartbreaking for me to talk to these families, day after day after day. Another one will call and I have to say, I'm really, really sorry, but I don't have a spot. And then when you give them other options, places that do have main care, there's not that many anymore. So as the numbers are growing of folks who are living in our state and aging and needing that level of care, there are fewer and fewer options available.
Okay, so how about private pay? Most facilities require proof that you can pay for 2 years of services before they'll even take you on. That means you need to have somewhere between $100,000 and $300,000 saved up.
It's heartbreaking because that generation especially, they saved all of their money. My parents saved all of the money they could save. And they wanted money to be able to pass down, and they wanted to be able to save for, emergencies or trips or traveling and, their lifelong dreams. And all of that money is gone.
So what can people do? Besides save lots of money and plan way ahead, there are other options.
For folks in their mid-50s, if you're healthy, buy long-term care insurance. Because that will help offset the cost of a lot of assisted living programs. And it gives you a little bit of an advantage if you can come with some assets to help private pay for a while.
I'm not quite sure what's going to happen in a couple of months when our money runs out. And so pre-planning definitely would have been the best thing to do, because if we had known that, at 50 years old you should get long-term disability or long-term care insurance, then we would have done that. We probably would have done that.
Now, in-home care is also an option, but that's either also main care only or private pay only, and there's another issue.
The workers themselves are not getting huge amounts of money to go in and help people with a bath or clean their home or any of those things, and it's tough work. I mean, I think some people just really, that's their passion and they do it despite the low wages, but I think we need to be looking at that as a state, that we need to compensate people more for doing that kind of work if we want to have enough people to do the work for the aging population that we have in Maine.